This is a story that has elicited a lot of mixed reactions from Kenyans across the Republic, especially this time that the country is celebrating the Golden Jubilee. Now let's bring in some reactions. Of course, we shall be talking to a commissioner of the Commission of the Implementation of the Constitution, CIC, that is Kamotho Waiganjo, who is in the Central Business District in Nairobi. We also have with us Sultani Matendechere, the Secretary General of the Kenya Medical Practitioners and Dentist Union, who is also with us from our city center studios. We also have a governor, that is the governor of Uasin Gishu County, Jackson Mandago, who is coming to you live from the county of Uasin Gishu. Now, gentlemen, this is a story that has brought it is an impasse currently. We have seen the situation in the different hospitals across the country, and the doctors say they will not budge. So what is the way forward as we speak? If we can start with you, Dr. Sultani Matendechere, your workers, your colleagues say they will not budge as far as the strike is concerned. What do you think is a way forward as we speak?
Okay, I think, first of all, let me say that it's a very big shame for us to get to this kind of, this point, just because we cannot be able to engage, we cannot drop our positions so that we can be able to come to an understanding. And this is a very poor show of leadership on our part, especially on the part of the government, because we have been engaging the government, and the government has been very adamant. They do not want to listen to the concerns of the health workers. But we are saying that as leaders of the health workers, we are ready anytime to sit down and agree with the government on a formula that is going to allow us to immediately end this suffering. Because we know that healthcare is an essential service, but we have come to learn of the shocking fact that in this country, the authorities do not want to consider this essential service as such.
Okay, Dr. So, your colleagues are saying that their main grievances are the salaries, emoluments, and of course the career development functions, which they are saying, you are saying they should not be reversed back to the national government. Let's bring in the CIC Commissioner, Kamotho Waiganjo. What does the Constitution say about this? Because it's a bit of bringing a bit of confusion.
Yeah. One, I think let me say that it's unfortunate that we are talking about this 2 years after the devolution train left the station. The reality is that Kenyans 2 years ago agreed that we were going to devolve all services, especially those services that affect Mwananchi, where it really matters. And one of those was health. All the laws that were necessary to ensure that this was done sequentially were passed. The County Government Act, the Transition to Devolved Government Act. The doctors have been part of this nation and part of the conversation about an effective way of transitioning to ensure that services are delivered where the Constitution requires them to be. I think for us at this point to be talking about the possibility of recentralizing, because that is what this conversation about, the possibility of recentralizing, is unfortunate. Remember that when it comes to the question of salaries for doctors, they are protected by the law. The county government law that exists protects the salaries of doctors. It protects their pensions. As long as you are employed before 2010, those salaries are protected. What we must recognize as a people is that devolution is now a reality. That everybody must now recognize that the county governments are legal entities that are entitled, are allowed to provide services. They have the funds to pay for those services. The question of standardization of salaries in terms of services is already agreed upon. So I think what is happening now is a desire to have a centralized process of managing staff. And I think we need to remember that for 50 years, we have tried centralized provision of services. If you ask the Kenyan in Wajir, health services have not been delivered properly. Why don't we allow the constitutional framework that we chose in 2010 to work? If it doesn't work in 3 years, we are the same people will come back and reevaluate it.
What the commissioner is saying is the what the commissioner is saying is the main bone of contention, Dr. Matendechere. Yes. The commissioner is saying that your salaries will be taken care of because it is inked in the Constitution. Are you satisfied, Dr.?
Okay, I think that is also one of the areas where we are not communicating with the government, because we have expressed that we are worried that this function, that is health, was devolved without any legislation being put in place. So right now we are devolving that function, and yet we don't have a guideline. We don't have a legal framework. We don't have a health policy in place. And that is why we are seeing a lot of confusion coming up. Recently, we even saw some documents coming around from the counties which are proposing salary cuts. We have seen people going to supervise doctors who are working in the hospitals, and yet these are just political officials within the county, because we don't have any set legal framework which is saying that this is how the HR policy is going to be rolled out. Who is going to supervise? How are you going to be paid? So now we are seeing a situation where advantage is being taken, or the absence of laws and policies, so that we can harass medical personnel. Now this situation is degenerating by the day, and we have been engaging the government since March.
Thank you, Daktari. Now, you and your colleagues, what you're saying is that you do not want what you're calling being forced to be absorbed by the county governments, and of course you're saying some of your colleagues have said that being absorbed by the counties will cause other things like nepotism and tribalism, and of course you're worried about your salaries. Let's now bring in the county governor of Uasin Gishu, Jackson Mandago, who, sir, you are supporting this initiative. You seem to think that this can work. Tell us.
Thank you, Kitile. One, basically, nothing has changed. What we are saying, a doctor that was working in Moiben Sub-District Hospital is still working in Moiben Sub-District Hospital. The salary that doctor was earning is still earning that salary. Number two, the scheme of service for nurses, for clinical officers, for doctors remains the same scheme of service that has been there. So there is no reason, absolutely, as to why the medical practitioners should worry about that. In fact, they should be happy, because what county governments have done is to put in a lot of resources, improving physical infrastructure and equipment, and ensuring the steady supply of medicine, which was not there before. If I give you a case example in my county, Moiben Hospital never had electricity.
Governor, are you going to slash the salaries of doctors?
That is, let me not be a little bit rude, but let me say, let them not stretch their minds beyond the normal. We are responsible citizens. As governors, we made the decision before the national government did, and we said counties may not have capacity now to handle the payroll. That's why we decided, as a council of governors, that the payroll be handled by the Ministry of Health for at least 6 months. Now, that has given us opportunity to go through the number of health staff we have. After doing our own audit, we discovered so many counties are paying so many health workers who are not in the station. What the health workers are not telling us is what they fear most is the close supervision they are going to receive from county governments, and that is their worry. You've had the governor of Waiganjo, Marakwet, being treated by a watchman. What kind of practice is this? When I look at their memorandum, they are saying there will be no standards. What standards have they been following? Because they have been serving in those hospitals, there must have been standards.
Thank you, Governor. Commissioner Waiganjo, just very quickly, yes, what is the way forward? What are we supposed to do as a country to avert or to make sure we solve this problem?
Now, I think part of the problem is that we're sometimes we are not a very dishonest country. I think part of the problem is we do not identify our real problems. The reality is that doctors' salaries, doctors' terms are protected. All the legal systems that are necessary are in place. Whatever is remaining, the Public Service Commission is supposed to be doing. I think if we recognize that devolution is a reality, let us find a way to ensure that people's terms are protected the way that the law has protected them. But if we take the position that the only way we will work is we work like the teachers work under TSC, under KNUT, we will bring our country down, and the people who pay a big price are the people who get our services. And it's unfortunate when it is professionals who are leading this cause. I think it is very, very unfortunate. Let's reason together and agree that we agree to devolve. We agree to devolve as a country. Everyone must recognize devolution is a reality.
Thank you, Commissioner. Thank you, gentlemen. It was a pleasure talking to you. I've been talking to the Commissioner of the Commission in the implementation of the Constitution, CIC, Kamotho Waiganjo, and of course, the Governor of Uasin Gishu County, Jackson Mandago, as well as the Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentist Union, Dr. Sultani Matendechere. Thank you, gentlemen. Always a pleasure talking to you. Let's now take you to our top story, and of course, the government and doctors read from different scripts as the nationwide strike began in earnest. The government insists that the doctors have no basis for their strike, while doctors vow to continue the boycott. The doctors are unhappy about the decision to make them answerable to county governments. KTN's Sharon Momanyi begins our coverage on that, continues our coverage on that particular point with a tough talk in the capital as patients suffered across the country.
Across the country, patients arrived to a sickening sight. No nurse to welcome them and no doctor to relieve their pain as the strike called by the health practitioners kicked off. But in Nairobi, no one was yielding any ground. Cabinet Secretary for Devolution, Anne Waigoro, says the matter is now off the hands of the national government and into those of county governments and the Ministry of Health.
Kitu ambacho kimewafanya waende strike ni kitu ambacho haziwezi kufanywa na serikali kwa sababu it's a legislative issue that has to do with the constitution, and we cannot promise that we will do it because according to the constitution it does not allow.
But the Workers' Umbrella Union claims devolution of these functions will promote nepotism and tribalism and thus may cripple the very critical function of the health sector. It seems, though, that this will not come easy.
There must be a guiding principle as what is provided for in Constitution of Social Security and the new bill.
They are not labor issues. They are issues that are beyond the resolution of either the Council of Governors or the national government or even Parliament. It will require, some of them would even require a referenda.
The immediate concern at the moment is the lives of the scores of Kenyans who depend on public health services.
Hii mishahara inatoka serikali ya kitaifa. Hakuna pesa ambao inatengenezwa na serikali za county. Governor anafanya kazi kwenye county, mshahara yake inalipwa na serikali ya kitaifa. Properly secured by the national government. Senator anafanya kazi yake kuwakilisha county. Mishahara yake is properly secured by the central government.
Speaking to KTN on phone, Cabinet Secretary for Health James Macharia says that the situation is dire and calls for drastic measures.
Start the counties, you start recruiting. Some of them have started recruiting. Today's paper you saw, I think it was Bomet County. They advertised for jobs, including health workers. For us as a ministry, we have so many people that applied for jobs. They were put on reserve. So we shall welcome them. We shall actually employ those people to go and fill the vacant positions. And so we are putting measures in place to, unfortunately, we have to do this.
But on their part, the Kenya Union of Civil Servants has opposed the strike. They say that over 80% of health workers belong to the union, but they found no basis for this decision.
It's true we participated in the passing the Constitution of Kenya, and we realized there are a lot of gaps. Those gaps cannot be addressed through the strike. We can only correct them if we follow the right channel.
The bone of contention is the salaries and emoluments, as well as the career development functions of the health sector, which the union wants to be handled by the central government. At the moment, hospitals in Eldoret, Nakuru, Laikipia, Kisumu, Kakamega, Migori, Bomet are among those affected. Sharon Momanyi, KTN.